lot of our parents are very motivated to put their children in our orthokeratology program. But just put yourself in the child's perspective. They're often 5, 6, 7, 8, 9, 10 years old. They're scared to death about oftentimes putting their finger near their eye. They're not motivated like the parents are to control their child's myopia. And in addition, they know subconsciously this is a lot of work. So the reason why I thought this was a great question is when you encounter this, you should know you're on the right track, because if you could tackle this, your practice will grow, because there are tricks that we've implemented that really have helped the INR process go a lot more smoothly, and also use it as a marketing tool. So when the child does start wearing them, it'll motivate parents to talk about it with people on the soccer field and in the schools to send their friends and family. That's what we discussed in the last episode. So I do have a lot of tips to give. It's real world experience. So I look forward to talking about it with you.
All right. So the part that gets to me here is, how many times should this person bring back their kid? If the parents
Yeah.
are highly motivated. So how many times do you let them come back?
Yeah, we let them as often as we think it will take for the child to learn. And if you remember from last time, Matt, we do a consultation. And the consultation is not only to find out what lens would fit this child best, but it's also to see how this child reacts. Because sometimes the child could be a -1 myope, but yet overly react to the feeling of a contact lens in their eye. So strategically, we know this is going to take more time, more chair cost, and we have to prepare for it. So during the consult, I'll prepare parents and say, listen, we're going to set up a class, but your child may need 2, maybe 3, because we know from experience, if they quote unquote fail after the second class, parents get nervous. There's a buyer remorse here. So we've implemented some changes in our system. We first tell the parent to be prepared for at least 1 to 2 classes, maybe 3. So we've pre-framed it that the parent knows we're not going to push this through. We allot about an hour for a class, and we often schedule them for the morning. And this is something parents resist because the parent works, the child is often in school pre-COVID, and they don't want to take the child out of school, and they definitely don't want to lose work to come in. But we tell parents of sensitive kids, this is a very good choice because the child's less tired, more attentive, less cranky, and more likely to pass the first time. So if the child doesn't pass the first time, we mandate that the second class is in the morning. If the child doesn't pass on the second class, we change insertion and removal technicians. Because even if this technician is wonderful, what we've found is the parents sometimes deflect the child's problem onto the technician. It's not my child, it's got to be the technician. So we're proactive. So number 1, we try to get those sensitive kids in the morning. Number 2, we prepare the parent that's going to take 2 or 3 classes. And after the second class, we change technician. And this is all before the patient comes in.
Yeah, that's really interesting. And you frame it as a class. So what part of it is a class like, if you could go into that?
Yeah, this is most important now than ever before with the pandemic. Because just picture this. The teacher has a mask like this on. The child has a similar mask on it. The parents have gloves sometimes and shields. There's an actual, in our office, plexiglass between the technician and the patient. And most of our patients are under 10, 12 years old. You can't think of a more intimidating atmosphere.
Right, exactly.
So what we do is we know these students that are interested in orthokeratology, they value education a lot. So we've likened it to a class, and no one wants to fail a class. Nobody. So we said, you're going to work with a technician, a teacher that will teach you how to put the lens in, and then you'll do it yourself. In order to pass the class, you have to do it by yourself 3 times. In our office, we make the parent wait outside for the first 2 insertion and removals. Then we bring the parent back for the 3rd insertion and removal, where we go over all the consent forms and the paperwork and things of that nature. The reason why we do that, parents are usually too intense, and the child gets nervous. They want to perform for the technician, but they also want to perform for the parent, and this sets up a very toxic situation. So we say to the parent, listen, wait out front, we'll call you back, we'll even let you videotape the last insertion and removal so they have something to look at. But we have found if we work on them one-on-one, they do a lot better. And to my surprise, this has been accepted really well.
Yeah, that resonates with me for sure, because when I worked in a couple of opticals, there was occasionally this moment where the parent is standing like this over the child.
Right.
And maybe they're saying some things to them because they want their kid to get this so badly.
Right, exactly.
Maybe there's some unnecessary external stimulus that if that was just removed, then the kid could do it because they have this pressure. So there were some instances where, like when I worked in Carrie's office, someone would invite the parent to come and look at additional paperwork for a brief moment. Like, oh, well, this may take a little bit longer. Why don't you come into the other room and we'll go over some of the other details and then we'll rejoin them. And then wouldn't you know it, in that moment, as soon as the parent is removed, the person working with the kid is like, okay, now deep breath, you can do this. And then all of a sudden the kid's got it. So when you mentioned that, that's the first thing that popped into my head, is just changing that one source of stimulus. I mean, you really can't fault a parent for wanting the best for their kid, but absolutely, everybody learns at their own pace, for sure.
Yep. And usually the parent is type A. That's why they want their kids to do this. And the child's type A. They don't want to let anybody down, but they also don't want to do this.